Hello, I'm live now. Please, I want you to drop in the chat. Just comment that you can hear me. I want to be sure that you can hear me. Good morning. Can you hear me, please? Okay. Are you guys together or are you in the class together or it's just or you are in different locations? Are you together? Ifeoluwa Latoye, yes, I can read your chat. Good morning. Are you together or you are in different places? Please let me know. You can drop. Okay, you are going back to the class. All right. So since you are not all together, I think I can just go ahead so you can watch. Um, Anywhere you are, you can watch. That's the reason why it is online lecture. So let's start. Just get a comfortable place to stay. If you know that you are not with your friends, if you're alone, it doesn't matter. Just stay wherever you are, stay, and then make sure you comment because at the end of this lecture, your comments will make me know that you're watch it, and that's what I'm going to use for the attendance. All right, so it's going to be a comprehensive lecture. So I'm going to take you three topics, and thereafter, the class governor, you because I'm not there with you, the class governor will take another attendance and it will be sent to me. All right, I know that's part of your CA. So once again, good morning, class. How are you doing? It's been a while. I've not been able to see you for roughly 4 months now because I'm on leave. It's not yet up to 4 months. I'm on leave or maternity leave. The last time you saw me, I was pregnant, and now I have my baby. So thanks be to God that we are together again. Because of the leave, that's why you've not been able to see me in class. So, but thankfully, if you have your notes with you, just the note that I sent through your rep, just open the notes and get along with me. So, yes, I've seen your comments. Thank you. You can pause, open the notes now in your book. I'm going to also share the screen. So, open the notes and let's start. All right. I will also be sharing my screen. So, please open the notes. And let's start the lecture proper. The nervous system, that's the course content for this and that 202. The nervous system. And, there are quite a lot of things that you need to know about the nervous system. All right. And I want to believe that Dr. Awoleye has taught you the basic thing that you need to know. So to start with, you have to know the divisions of the nervous system. When you remember the nervous system, just remember the central processing unit. Or let me say, look at the computer system. It's just the coordination of the body. That's what the nervous system is all about. And majorly, this is done by the neurons. Okay, the nerve um, the neurons, the nerve. All right. So, but majorly we have two types or two divisions of the nervous system. We have the central nervous system and the peripheral nervous system. Okay, the central nervous system comprises of the brain and the spinal cord, all right? Those are the two main contents of the central nervous system. Now, every other coordination outside the brain and the spinal cord is the peripheral nervous system. And the peripheral nervous system is subdivided also into two. You have the sensory and the motor. There are the sensory is things that bring information, impulses to the brain, while the motor nervous system or the motor peripheral nervous system is what bring information away from the brain to the particular organ. We call it the target organ. All right, for instance, you see through your eyes. That's a sense to the brain. Anything you see immediately passes to the brain. But for the motor nervous system, information is coming from the brain, all right, or from the central nervous system down to that particular organ. All right. So the sensory nervous system has to do with coordination of what you can see, what you can smell, what you can hear, what you can touch. I will simply call them the sense organs. Okay. Now, for the motor nervous system, it has to do with, you know, information from the brain to that particular organ. And the major function of the peripheral nervous system is to maintain homeostasis in the body. You remember, to make sure that the body is well regulated. Okay, that's a major function of the peripheral nervous system. Are we together? So, the motor neuron, I've told you that is a formation coming from the brain down to, I mean, from the central nervous system down to the particular, to the target organ. So let's look at the autonomic nervous system. The autonomic nervous system is a division of that peripheral nervous system. Like I told you, that we have it from the sensory to the motor. So even in the motor nervous system, you still have the somatic nervous system and the viscera. The viscera is organs. When you hear viscera, they are organs that are automatic or that are not coordinated by you. They are autonomic. They are things that they are not somatic. Somatic has to do with probably skeletal muscles, movement, what you can, like the joints and the ligaments, you can control that. But for the visceral organs, which you can call them the autonomic, they are things that you part of the body or organs of the body that are involuntarily coordinated. I think that's the best way to put it, that they are not voluntary. Okay, so the autonomic nervous system is the visceral motor division. Don't forget, we have, please, 1 minute. Let me try and put my board at the back so that I can draw something for you. All right. I hope we are together. Let me try and use this board to explain um, what. Okay. I hope you can see the board. Can you see the board? Just type yes if you can see the board. Just manage the board, please. This is the nervous system. All right. The nervous system is divided into the central nervous system and the peripheral nervous system. I told you that can you see? Can you see very well? Good. Thank you. Oh, you should be able to see the board. Please try and manage to see it. So the central nervous system is comprises of the brain, okay, and the spinal cord. Here you have the brain and the spinal cord. So I am not taking you this one. I believe that Dr. Awole would have taken you the brain and the spinal cord. That's the coordination of the central nervous system. Now, the peripheral nervous system is now divided into two again. Are we together, class? You have the sensory nervous system and the motor. Sorry, the marker is the motor here. You have the sensory nervous system. The marker is not working well. And the motor nervous system. Let me try and see if another marker will work. Okay, I can't locate another marker now. Please just get along with me. We have the sensory and the motor nervous system. I told you that the sensory nervous system is taking information back to the central nervous system. I hope you can get me. Information from what you have outside is going from the sensory nervous system to the central nervous system. Now we now have the motor nervous system. Information is coming from the brain to the motor nervous system. This is the motor nervous system. And here is the sensory nervous system. I said the sensory nervous system, just remember the sense organs from what you can see, what you can hear, the what you can perceive, the touch and all that, touch of the body. But from the motor nervous system is the information from the central nervous system to the organs that you have here. So this motor nervous system and this is further divided into somatic and this one visceral. Somatic are organs of the body falls under other any organ of the body that can be voluntarily controlled falls under somatic division. While any organs of the body that cannot be voluntarily controlled falls under viscera. So anytime you hear viscera, you are talking about organs that cannot be controlled voluntarily. For instance, your heartbeat. You cannot control how your heart beats. You cannot control how the digestive system digest your body. All right. So this division is now divided into this viscera is divided into is what you call the autonomic nervous system. Okay, visceral, autonomic, not voluntarily controlled. So this autonomic division is divided into three. I want you to understand this chart. The first one is the sympathetic nervous system, popularly called the SNS, then the parasympathetic nervous system, all right, sympathetic nervous system, parasympathetic nervous system, and of course the third one is not popularly called, but sometimes because the division is sometimes known as sympathetic and parasympathetic nervous system. But for you have to understand that we also have the third one called the enteric nervous system. Enteric, this has to do mostly with the gastrointestinal tract, the GIT. Okay, so I hope you understand the division. I'm not going to talk about the central nervous system again. Let's talk about the peripheral nervous system. The peripheral nervous system is divided into also the sensory division and the motor division. The sensory division is the part or the division of the peripheral nervous system that brings information to the central nervous system. For instance, like if I say you should remember the laptop. Let's look at desktop, look at the setup of a computer, the monitor and all that. You know, through the keyboard you type, you send information to the system, the central processing unit now process it. So the central processing unit is like your brain and the spinal cord, okay? And of course, you have information out. The central nervous system now gives you information like something like your speaker and all that, you know, where what you hear, what you see on the screen and all that. So we have the sensory, remember the sense organ, then we have the motor. The motor is now divided into two different parts. The part of the body that cannot be voluntarily controlled, that's the somatic part of the body. And I mentioned that you have the joints, the ligaments, and different parts of the body that of course you can control yourself. And the other part is the visceral part, which are the parts of the body that cannot be controlled, and that are autonomic. You can't control them. Auto, like you can, it's not something that you can control. So we have it now divided into three: the sympathetic nervous system, the parasympathetic nervous system, and of course the enteric nervous system. And I told you that the enteric is particularly connected to the GI tract. Please, do you understand the chart? And I mentioned that the sensory part of the peripheral nervous system takes information to the brain, while the motor part of this peripheral nervous system takes information from the brain, direction, impulses from the brain. I hope you get the chart. Can we continue now? Please let me see your comment. Did you get the chart? Do you get the way the thing operates now? That's the background knowledge of the peripheral nervous system as it relates to the central nervous system. Okay. All right. Thank you. Since you can get that, I think I can go ahead with the next notes. So I mentioned that the autonomic nervous system is the visceral motor division. Remember, we have two divisions, the somatic and the visceral. So the visceral motor division of the peripheral nervous system. And the major function is to bring about internal homeostasis. Remember, underlying homeostasis, all right, to maintain the body, to control it. And these are the things that it controls: the cardiac muscles. I told you the cardiac muscle is your heart. It has to do with the heart, the muscles in the heart, the smooth muscles. You have smooth muscles across different parts of the bodies. Okay, you have the glands, the blood vessels, the GI tract. I told you the GI tract has to be associated is associated with the enteric nervous system, the urinary tract. Of course, you don't know how the kidney uh, produce the urination on your body. You are not the one controlling it. All right. Respirate, you know, the way you breathe, the way your the senses or captures things. It's not something that you can control. You have the smooth muscles almost in every part of the body. All right. For instance, for women, you don't know how the blood is being produced. You're not the one controlling um, the menstrual cycle. It is something autonomic. All right. So, but I mentioned that unlike this somatic nervous system that is controlled voluntarily, okay, your muscles, you can move your joints and all that. So autonomic is not voluntarily controlled. Okay, please establish that. Now, you've seen the charts that I draw the other time. So now let's talk about, you know, for you to understand this course, please take your time to know how the chart operates, like the diagram. Is not a course that is abstract. You have to understand the diagram, how it relates to each other. So please take your time. I learned that you are not starting exam with the other students. So take your time to understand the chart, how it operates, okay, so that you get it. So for I told you about the three divisions that we have: the sympathetic, the parasympathetic, and the enteric. You have to know this term. For the sympathetic nervous system is also called the thoracolumbar uh, nervous system. Thoracolumbar because it has to do with the origin of that nervous system. You know, we have different from the nerves, the cranium, the nerve cells, how it relates. So it has its origin from the thoracic region down to the lumbar region. I'll still get there. And also we have the parasympathetic, which has its origin from the cranium down to the sacrum. You have to see if you have done, I don't think you have done that part in anatomy, but if you have not done anatomy, you should have anatomy of, if you have not done, let us start by the way. So we have this cervical vertebra. I'm talking about the vertebral column now. The cervical vertebra, the thoracic, that's the part that you have in the trunk, and the lumbar, and of course the sacrum. So that thoracic vertebra, it has the nerves has their origin from those vertebrae. So please understand that. Now, the way the organization of the autonomic nervous system, it has a pathway. For this, the pathway is that the autonomic nervous system contains two neurons, and the neurons is just the preganglionic neuron and the postganglionic neuron. The pre you have it also in both the sympathetic nervous system and the parasympathetic. By the time towards the end of the class of this particular topic, I'm going to tell you the differences between the parasympathetic and the sympathetic nervous system. All right. So the preganglion and the postganglion, the pre, I think I will have to also use the board again. So coming for the preganglion, you know, it's like this. You have the nerve, the pre. I told you that the information is coming from the central nervous system. So this is the nerve, the neuron. You have the pre and you have the post. Two parts. The pre here, because it is going to a target organ. The pre here is short while the post is long. And also for the other part, the parasympathetic will still get there, because the sympathetic nervous system, it wants to locate that particular organ. So you the preganglion part of this autonomic of this neuron is located in the brain. Okay, in the central nervous, sorry if I'm saying the brain, is located in the central nervous system. So the preganglion neuron leaves the central nervous system, and of course the synapse inside the autonomic ganglion, and extend to the second neuron, the second part, which is the postganglion neuron. So the postganglionic neuron then acts on the target organ, which is an effector organ, because the sensation when you EFF, ECTOR, effect is coming outside. All right. So you must have heard of efferent nerves, afferent nerve. Efferent means that nerve is leaving the central nervous system. Afferent is that nerve is bringing information back to the central nervous system. So for this sympathetic nervous system, or for the autonomic nervous system, we have just two neurons, the preganglionic neuron and the postganglionic neuron. The preganglionic neuron leaves the central nervous system, then it synapses with the postganglionic neuron and then acts on the target organ. All right, so let's look at the sympathetic nervous system as a whole. I told you that the sympathetic nervous system originates from the you have the spinal cord. It is located inside the vertebra. Okay, the vertebrae, from the cervical down to from the cervical region down to the sacrum region. That's where you have the spinal cord located. So in each of these spinal cord segments, the there are different nerves that originate from those regions. But for the sympathetic nervous system, it originates, like I told you, that it is called thoracolumbar. meaning that it originates from the thoracic region to the lumbar region. So it has the origin from T1, that's thoracic 1, thoracic vertebra 1 to the lumbar 2 or number 3, L2 or L3. It has origin from T1 to L2, or in some cases we have it from T1 to L3. That T1 means thoracic 1, then the L, number 2 or number 3. So the same body line in the lateral horn. Go and look at the diagram of the spinal cord. So please notice, locate the lateral horn. But maybe at the end of, maybe probably that will be your assignment. You can draw a well labeled diagram of the spinal cord. All right. Then locate the lateral horn, locate the mediolateral cell column. That's where the cell body lies in the spinal cord. All right. So from the spinal cord, it passes through, we are describing the pathway of the sympathetic nervous system now. So from the spinal cord, it passes through the ventral root of the spinal cord down to the spinal nerve, then of course to the white ramus communication and the sympathetic chain ganglion, then to the post ganglion region. We told you that it's two neurons from the pre to the post, and of course from the post ganglion region it passes through the gray ramus communications, then it locates the target organ. This thing is very short and fast, so don't like before it passes through different locations, and it acts, but it like it's an impulse, so it acts quickly, just like if you type something on your phone now, it immediately you will see it. So that's the same thing that is also operating from different region before it locates the target organ. All right, so please, you have to go and look at the ganglionic chain, the pathway of that neuron. All right, so next let's look at the characteristics of the sympathetic fibers. The sympathetic fibers are different characteristics. Just like I told you, there are two main fibers, two main neurons in the sympathetic or in the autonomic nervous system, both in the sympathetic and the parasympathetic. So, but there are just differences. Both of them, there are two. We have the preganglionic fiber in both sympathetic and parasympathetic, but they have different characteristics. Firstly, is that the preganglionic fiber of the sympathetic nervous system is short, and of course it is myelinated, that it is shielded. All right, it is myelinated. There is something we call myelin. You can read it. That's a function of in the neuron. Okay, and also in the post um ganglionic fiber of the sympathetic nervous system, it is long and it is unmyelinated, it is not shielded. Okay, and no myelin sheaths. So, and the major effect or major function of this, please, you have to note this because it will definitely come out in your exam. The major effect of the sympathetic stimulation, because once it is stimulated, all right, I think I need to also make you understand this. There is a term that will help you. It is commonly called fight or flight in the sympathetic nervous system. While in the parasympathetic nervous system, it is called rest and digest. For the sympathetic nervous system, it has to make you do something quickly. For instance, if you see that there is a danger coming, probably there is a fire outbreak and all that, you see the way you run, or probably you hear a news, probably something terrible, your heart rate will increase. So that is what um the sympathetic nervous system is. It makes you to act quickly, urgently, a response to something. For instance, it bring about increase in the heart rate. All right, the pulse begin to increase, probably you hear of probably something, a danger or wherever. It's to make you fight or flight, like run. That's the function of the sympathetic nervous system. Now that is why the postganglion is long. All right, postganglionic neuron is long, and why the pre is short. The pre is to leave is to leave the central nervous system. The sense is to the nerve is to leave the central nervous system quickly and act on that particular organ. So for instance, you can also have another target organ is, I talk about the increased heart rate. It also bring about increased blood pressure. Okay, it bring about dilation of the pupils. All right, the pupils dilate, your eye will be eye widely open. It bring about increased sweating. If you hear a news that probably something is for instance, when your result was released, probably your ana, which one did I teach you last semester? Ana 203, right? There is a way you'll be sweating profusely because there is a sense coming, and if an impulse coming directly from the central nervous system to your sweat gland. So it acts also on the sweat gland, okay. It acts on the skin. So also it acts on the skeletal muscle, bring about vasodilation of the skeletal muscles. Okay, now you see, begin to swell. It has on the sweat gland. Also it reduce the gastrointestinal mobility. Please note all this function. It increases the heart rate, it increases the blood pressure. All right, note other things that it does. It increases the sweat gland to bring out, it increases the sweating rather in the sweat gland. Okay, do you get that? Class, let me look at the comment section if you are getting me. I know it's a complex topic, but are we together? Please drop comments. I don't think I can see the live chat. Can you hear me? Do you get the topic? Can I proceed to the parasympathetic nervous system? Please drop your comment. I can't see any comment. Hello. All right. Deborah Adebayo, thank you. Say yes, ma. All right. Okay. Oluwaseyi, thank you. I can see your comments. Okay. Okay. All right. So right now I can proceed to, okay, thank you. Peculiar. It's 100%. Okay, thank you. So just understand that the parasympathetic nervous system is a fight or flight system, nervous system, because it brings about increase in the blood rate, increase in the blood pressure, increase in sweating, all right, as dilation of the um, skeletal muscle, etc., etc. All right, it's also reduce the GI tract, etc., etc. So let's go to the parasympathetic nervous system. Remember when I was explaining to you the other time, I told you that the neurons in the in this autonomic nervous system, don't mind if it is sympathetic or parasympathetic, neuron is two: the preganglionic neuron and the postganglionic. Then you can stop the comment now. Please listen to me. Thank you. The preganglionic neuron and the postganglionic neuron. Okay, in the sympathetic nervous system, the preganglionic neuron is short, while the postganglionic neuron is long because it's acting fast on the target organ. But for the parasympathetic nervous system, the preganglionic neuron is long, while the postganglionic neuron is short. Okay, those are the differences. All right, please note the differences between the two. So please look at your notes. Now let's look at the origin. I told you that the sympathetic nervous system is called thoracolumbar. All right, thoracolumbar nervous system. Okay, why this one parasympathetic is called it's having its origin from the cranial nerves, from cranial nerve 3, cranial nerve 4, cranial nerve 7, that's the facial nerve. You have to know we have 10 cranial nerves, all right? But I'm not going to go deep into that for this class. We have 10 cranial nerves in neuroanatomy, okay? Cranial nerve 1 to 10. But for the case of just for this topic, the parasympathetic nervous system originates from 4 cranial nerves. We have the cranial nerve uh, 3, cranial nerve 7 cranial nerve, 9 and cranial nerve 10. The cranial nerve 3 is the oculomotor cranial nerve. The cranial nerve 7 is the facial nerve. That's the nerve that sends impulses to the face, the facial part of the body, and the neck and all that. You can go and read it all, but for the this topic, we also have the glossopharyngeal nerve from glosso, from this part of the body, and we also have the vagus nerve. These are the cranial nerves where the parasympathetic nervous system originates from, and the segments in the spinal cord, we have it from sacrum 2 to the sacral 4, S2 to S4, S2 to S4. Don't forget, I gave you an assignment to draw the vertebral column and also draw the way the spinal cord originates from the vertebral column. Okay, from the cranial nerve down to the sacrum. Please draw it so that you understand the origin of this sympathetic and parasympathetic nervous system. Okay, now let's look at the pathway. The pathway of the sympathetic nervous system, parasympathetic nervous system, starts from the brainstem of the brainstem or the sacral cord, from the spinal cord down to the preganglionic fiber. From the I told you that the preganglionic fiber of this spinal, of this parasympathetic part nervous system, is longer, while it is short in the sympathetic nervous system. So for this, the PNS, the preganglionic fiber then acts on the passes through the terminal ganglion to the post. If you look at the way it is longer, while the post ganglionic fiber is shorter. If you look at the pre-ganglionic fiber, it passes through different pathway, alright. Even after it leaves the post ganglionic neuron, it still pass through the gray ramus communication before it acts on the target organ. But for this, it is straight away from the post ganglionic fiber directly on the target organ. Do you get? So, and it has different function also. Just for instance, you have it located, and this neuron, this ganglion, is very located close to the target organ, close to it, because the postganglionic region is short while the pre is long. So you have it in the heart, you have it in the bladder, in the gastrointestinal tract, etc., etc. So let's look at the function of the post sympathetic, I mean the parasympathetic nervous system. Okay, I've not talked about the characteristics. Let's look at the characteristics of the fiber. It is long. I think, okay, I've mentioned it. The preganglionic fiber is long. The postganglionic fiber is short. Of course, then the preganglionic fiber is myelinated and the postganglionic fiber is unmyelinated, just similar to what you have in the sympathetic nervous system. Now, let's look at the effect or the function. Remember that the sympathetic bring about increase heart rate, increase in the blood pressure, of course, reduce gastrointestinal tract, increase sweating and all that. But for the parasympathetic nervous system, it reduces the heart rate. So also it bring about the bronchoconstriction, the bronchi, constrict. It also increase salivation. When there is an impulse directly from the parasympathetic nervous system, you begin to salivate more. Also, it increase lacrimination, all right, in the eye. You also have increase intestinal mobility. Remember that the sympathetic nervous system reduces the GI tract, but for this, it increases the GI tract, and of course, it makes the bladder to contract. It makes the bladder to contract. So these are the functions of the parasympathetic nervous system. The last part of the sympathetic of the autonomic nervous system rather is the enteric nervous system. And this enteric nervous system, it contains millions of neurons and is capable of coordinating the GI tract independently. And that's why I told you that it is not most of the time mentioned, because they believe that it's also part of the sympathetic nervous system and the parasympathetic nervous system that is their also. But this enteric nervous system can control the GI tract independently. All right. And of course, this, if you, yeah, I think I taught you digestive system in ANA 203, right? If you remember the digestive system, for instance, it has the mucosa, the sub. Can you still remember? Class, can you still remember the mucosa, the submucosa, all right, the muscular layer, and of course the last part of the GI tract? Okay, now for the mucosa, you have the epithelium. Okay, the epithelium surrounded by light and supported by this. Okay, good. You can remember. Good. Thank you. So we have some nerve supply in the different layers of the GI tract. So, for instance, now we have the submucosal flexus in the GI tract. You have the Hirschbach flexus called myenteric flexus, which is located in the circular muscle of the GI tract. Okay, you have it in the inner, it's located between the inner circular and the longitudinal muscle of the GI tract, and the major function is to control mobility. And that's why you see that you are not the one controlling how the GI tract moves in your body. You can't control how food move from the stomach down to the small intestine or to the large intestine. Also, you also have the submucosal flexus, or called the Meissner's flexus, which is located within the submucosa, and the major function is to control secretion. All right, blood flow, absorption, etc. You have it in the small intestine, you have it all right, also in the large intestine. Now, let's talk about the neurotransmitters of the autonomic nervous system. I mentioned the other time that we have the ganglionic neurons, all right? We also have the post-ganglionic neuron. So the major transmitter of all preganglionic neurons, remember we have it different in the parasympathetic and both in the and also in the sympathetic. It is the acetylcholine. That's the neurotransmitter. Please note it, the acetylcholine is the neurotransmitter in the autonomic nervous system, and also in the parasympathetic postganglion you have the acetylcholine. But in most sympathetic postganglion, which is long, remember it is long, we have the non-epinephrine as the neurotransmitter. Norepinephrine, that's a major neurotransmitter to the sympathetic postganglion. But in the pre ganglionic preganglionic neuron and the postganglionic neuron of the parasympathetic nervous system, you have acetylcholine. That's that's the neurotransmitter. But there's an exception to the sympathetic postganglionic neuron, which the neurotransmitter is a non-epinephrine. Okay, so also let's look at some exceptions. In the sympathetic fiber supplying, I told you that the fiber, I'm talking of the impulse, the fibers in the sweat gland, the neurotransmitter is the acetylcholine, right? Also, in some skeletal muscles, we have acetylcholine also. While in the adrenal medulla releases adrenaline and non-adrenaline directly into the circulation. So there is an exception in the sweat gland, in the skeletal muscles, and also in the adrenal medulla. All right, the adrenal medulla in the adrenal gland releases adrenaline and non-adrenaline directly into the circulation, into the blood system. Okay, also we have the receptors. You have to understand the receptors of each of this autonomic nervous system. The autonomic receptors are the cholinergic receptor, you are right, and which are located in the autonomic ganglia and the adrenal medulla. Alright, it's located in the autonomic ganglia, that's the cholinergic um, receptor. And of course, we also have the muscarinic receptor. It's located in the heart, in the glands, in the smooth muscle, and of course, you have its subtypes as muscarinic 1 to muscarinic 5. All right. We also have the adrenergic receptors. We have the alpha 1, alpha 2. All right. We have the beta 1, beta 2, beta 3. Go and read up the locations. For instance, the beta 1 is located in the heart, and it bring about increase in the heart rate, increase force, and that's has to do with sympathetic nervous system. All right. So let's look at the comparison now. Let's compare sympathetic nervous system to parasympathetic nervous system. You have the sympathetic nervous system originated from the T1 to L2, and of course, the parasympathetic nervous system has its origin from these cranial nerves 3, 7, and 9, 10. All right, nerve cranial nerve 3, cranial nerve 7, cranial nerve 9 and 10, and of course you have it located from the sacrum 2 to sacrum 4, and also the ganglia is located near the spinal cord, like I explained earlier, while in the parasympathetic nervous system the ganglion is located close to the target organ. That's why the post ganglionic region neuron is short in the parasympathetic nervous system. All right. All right, it's also there. The preganglionic fiber is short in the sympathetic nervous system, while in the other nervous system it is long. And the postganglionic fiber, it is long in in sympathetic nervous system three, and also short in the parasympathetic nervous system because it is closer to the target organ. And also, of course, I mentioned the neurotransmitter. In the sympathetic nervous system, you have the neurotransmitter to be non-epinephrine, while in the parasympathetic nervous system, you have unlike in the sympathetic nervous system, while most of the ganglion is neurotransmitter is the non-epinephrine, but in the parasympathetic nervous system, you have it to be acetylcholine. And of course, I told you that the main term that you should remember for the sympathetic nervous system, it is fight or flight. It makes you to act. Why the parasympathetic nervous system is to rest and digest. That's why you have the reduced rate compared to what, for instance, when you are sleeping, your bleeding rate, reduce compared to how it is when probably you had an information or you are walking or you are running. All right. Are we together? Are we together? Okay. So the central nervous system, how is it controlled? The major control of the central control of the autonomic nervous system is from the following. Number one, from the hypothalamus, the brainstem, the limbic system, the cerebral cortex. Okay, go and look at it. For instance, the brainstem, the medulla oblongata, heart or the cardiovascular muscle and the respiratory centers. Okay, so go and look at the control of the cell. Please read up that part because it's going to come out in your exam. Quickly, let's look at the clinical correlations because you are pharmacist, right? Class, are we together? So it's very important for you to know how this relates to uh, the body. It's not just for head knowledge. You are not reading just to be a scientist. You are reading to act as a pharmacist. So let's look at the Horner syndrome. The Horner syndrome is caused by interruption of the sympathetic supply to the head, and this has a lot of issues. You can see people that have this syndrome, they it causes a lot of dangers to them. Sorry, 1 minute. Yes. All right, sorry, please. I needed to. I'm on leave, so please just get me. I have I have a visitor, so I've told her that I'm in a class. So let's go to the autonomic neuropathy. The autonomic neuropathy, you have it is common. Its common causes include probably diabetes mellitus, Parkinson disease. You know, there are some people that you see that their hands will be shaking, and this is as a result, this leads to autonomic neuropathy, okay? Because when you see that some people they are not coordinated again, and that's why it affects their urination, it affects a lot, it bring about abnormal sweating. They begin to smell sweat anyhow. It causes hypotension, their blood vessels, blood pressure reduces and all that. So please look at the features of each of these clinical correlates, from the Horner syndrome to the autonomic neuropathy, also to the pheochromocytoma of so because these are things that affect um these are the clinical correlates, things that affect, they bring about diseases and things that affect the autonomic nervous system. Now, how is this relevant to you? um the As a pharmacist, it is very important for you to understand the kind of drug that are being administered or by people, and the mechanism of operation of this drug. Okay, please read that part very well. Some people just take drugs anyhow without knowing the effect. As little as, I don't want to mention brand name now, when you have headache, you take this particular drug, it has its effect. Or when you have your GIT is not coordinated and you take it, I'm purging, I'm stooling, you take it, it has an effect on the nervous system, the autonomic nervous system. So there is the essence of this course is to make you understand how the body is being coordinated, how fibers leaves the central nervous system to different parts of the body, the organs of the body, and how um fibers leave the organs of the body, I mean senses, organ bring information from different parts of the body down to the central nervous system. So anything we take as a way of affecting the body system. You can look at the drugs that I've listed in the lecture notes, and how their mechanism of operation and their clinical use. Okay. I think that's that about the autonomic nervous system. Before we continue, I hope there is no question on that. If there is question on that, you can drop it in the comment section before I move on to the embryology of the nervous system. Please understand the chart, how the central nervous system is divided. For instance, I can ask you a question now, that the brain is part of the peripheral nervous system. Is that yes or no? Is that true or false? The brain is part of the peripheral nervous system. True or false? Let me see your comment. The brain is part is a division of this peripheral nervous system. True or false? Good. Okay. And the spinal cord is a division of the peripheral nervous system. True or false? Okay, question number two. In the parasympathetic nervous system, the postganglion fiber or the postganglion renal is short. True or false? Parasympathetic nervous system, the postganglion renal is short. True or false? I'm just seeing first. Which one are you responding to? Is it question one or question two? In the parasympathetic nervous system, the post-glanonic neuron is short. Okay, you have a lecture now. All right. So should we when next should we continue? Class rep, please call me now. Please give me a call now. I learned you said you have a lecture. Give me a call. It's a comprehensive topic. When next should we continue? Please, class governor, call me now. Let me know when we'll continue. We still have two more topics. It's a very comprehensive lecture. The 1 hour cannot be enough. Good. Yes. Question two is true. Yes, you are correct. So please, yeah, is the class governor here? Can you call me now? Let me know so that we won't obstruct the lecture that you're having. Possibly we fix a lecture for maybe evening. I want to make sure I complete it today so that you're gonna have time to read. So the other two lectures so that we can read. Is the class governor there? Can you call me? Let me, let me call Richard. Yeah, yes. Thank you. Very well. Please make sure you take the attendance. Your class governor is not picking my call. I want to be sure if I went the class or is Dr. Awole here with you already now? Hello, Richard. How are you? Yes, how are you? Okay, you have a class now. So when should we fix our lecture? What do you say? I can't hear you very well. What do you say? Let me call you in normal. Is it going to be what? Okay. Okay, can we make it in the evening? Okay, you know what? Let me just end the class now. So you then call me. So we'll fix probably today. I want to make sure I take it today so that we'll finish the lecture. So if it's today or probably if it's tomorrow, just let me know the time that is convenient. If you have lecture, just let me end the class so that I can call you normal call. Since the network is not okay, so please after now communicate with me. All right, class. Thank you very much. I'm going to communicate with your class governor and he will get across to you. Please make sure you read the notes. The question will come directly from the notes from what I taught you, and then we will see. If not today, that will be tomorrow. Thank you for your time. All right, your assignment, please, you're going to submit it tomorrow. Yes, submit the assignment tomorrow to your class governor. Yes, or possibly, yeah, tomorrow. Tomorrow is fine. Okay, so please have a nice day. Thank you for your time. Bye.